I got 2 cups, one for the tea, one for the coffee. Yeah, they call me Cammy Gates. They actually never called me that, but we're gonna finish our discussion today on the, you bet, on the what system we talked about? Oh yeah, that's right, the skeletal system here. So we're gonna finish our discussion here on the skeletal system. It's not goodbye, it's see you soon. How about that? But today we're going to talk about osteoporosis. So osteoporosis is the degeneration of bone tissue. It's when there's greater osteoclast activity than osteoblast activity. So think of it like there's a nice tug of war battle going on between the osteoclast and the osteoblast, and in osteoporosis, the osteoclasts are winning this tug of war battle. So both men and women can get osteoporosis. Women are more inclined to it, more susceptible. We'll learn why in a second. But both males and females can go through osteoporosis and be diagnosed with osteoporosis. So there's lots of missing bone tissue with osteoporosis. That's due to that osteoclast activity outweighing the osteoblast activity. So more bones being broken down than bone is being built up. So the effects of osteoporosis is, if you think about it, it's obviously increased fractures, and the increased fractures also leads to an increased healing time since there's not as much osteoblast activity, so bones not being built, more bones being broke down to the osteoclast activity. So the increased fracture leads to increased healing time. Instead of maybe 6 to 8 weeks to heal a broken bone, it might take months. So these increased fractures and increased healing time also results in decreased mobility. So decreased mobility, you aren't going to be moving as much because you're healing from the bones for months instead of weeks. This decreased mobility leads to a decrease of blood flow. Decrease of blood flow can lead to muscles atrophying, so the wasting away, the eating away of muscles. So this is a positive feedback for the decreased mobility. Whenever your muscles are getting weaker, you're going to want to move less and less, which is that positive feedback. The response enhances the stimulus in this case. Also, decreased mobility increases the risk of decubitus ulcers, aka bed sores. We've learned about those in a prior video here. So it increases the risk of decubitus ulcers, which also increases the risk of infection, obviously there. And decreased mobility leads to an increase in lower respiratory diseases. So you aren't moving, you're staying stagnant. That's going to increase the risk of lower respiratory diseases. And last but certainly not least, decreased mobility due to the increase of fractures and increased healing time leads to an increase of depression. So if you aren't moving around a lot, depression is probably going to increase there, especially if you're susceptible, whether genetically or just more prone to depression. Decreased mobility is going to increase depression more than likely, and this is also a positive feedback mechanism because whenever you're moving less and less, you actually increase the depression more and more, which is it's a vicious positive feedback cycle there. So you aren't moving, you're depressed, and the depression makes you want to move less and less there. So those are some effects of osteoporosis, some risk factors, some potential causes or reasons that osteoporosis does manifest itself is for a few reasons here. So it's decreased nutrition. So poor nutrition, low calcium diet leads to weaker bones. So the calcium isn't being built up in the blood or bone, which makes the bones weaker, which makes them more susceptible, and the increased osteoclast activity is obviously going to eat away at the less amount of bone, if you will, or the weaker bones you have, and make them even more weaker. So poor nutrition, low calcium is a risk factor for osteoporosis. Also gender. So a woman are at greater risk for osteoporosis. So both men and women can go through or be diagnosed with osteoporosis, except women are at a much greater risk for a a couple reasons. So first off, women have a smaller frame to begin with than men, generally speaking, so there's less bone to work with, essentially. So obviously less bone means the osteoclast activity is going to eat away the bone quicker, put it that way. And also menopause is a major risk factor of osteoporosis, because when women go through menopause, what happens is estrogen is not being produced from the ovaries anymore, so there's no more osteoblast activity, so bones not being built. So especially when women go through menopause early, the osteoblast activity stops, so women are at a higher risk for osteoporosis, but especially women who go through menopause early, you're at the greatest risk of osteoporosis. And last but certainly, or a couple more actually, is smoking. Once again, never a good thing. It increases the risk of osteoporosis. Fair skin also increases the risk of osteoporosis. So if you have fair skin, you're going to have less exposure to UV light, which skin cells aren't going to produce inactive form of vitamin D. The inactive form of vitamin D isn't going to go to the liver where calcidiol is made, and the calcidiol is not going to go to the kidney where calcitriol, or the active form of vitamin D, is made. So there's going to be less calcitriol produced because there's less exposure to UV rays as well. So less calcitriol leads to because there's less exposure to UV rays, and that's a risk of osteoporosis, is fair skin, because people do have less calcitriol production there. And also not fair skin, just whenever the lack of weight-bearing exercises is a risk factor for osteoporosis. So weight-bearing exercises, stronger muscles lead to stronger bones. So if you're pumping iron, even if you're running, doing push-ups, those are all weight-bearing exercises. There's weight-bearing on the ground. However, swimming and biking are not weight-bearing exercises. So lack of weight-bearing exercises like like biking and swimming do increase the risk of osteoporosis. So if you're a biker or a swimmer, try to do some weight-bearing exercises to decrease your risk of osteoporosis.